Hi, everyone. My name is Selena Belisle, and I'm the founder at CE Institute, where we teach geriatric bodywork and massage classes. Now, we've heard from some therapists that, they know geriatric bodywork. You just work lighter. And that is not the best approach to working with your geriatric clientele. Geriatrics are fabulous clients. They always keep their appointments. They're never tardy. You aren't trying to switch them around last minute because they were not responsible with their time and they overslept and all types of other issues that you might have with a younger clientele. I personally have found that geriatric clientele are very loyal. They're very regular. It's a stable work environment to work with an older clientele, and I just love it. Now, in order to work with geriatric clients, there are some required medical conditions that you need to learn. It's not about just doing less pressure. You need to learn the aging process. Just like in prenatal massage, you wouldn't dream of doing a prenatal massage without learning about the changes that are happening in the pregnant body. Well, why would that be any different with the geriatric clientele? There is a lot of change that happens in our body as we age. It takes us 6 hours to go over these medical changes and the aging process, and I'm not going to do that in the next 6 minutes. But in the next 6 minutes, I will review with you what you should know about. So you can either maybe study it further on your own, or you can come and take our geriatric bodywork class where we spend the 6 hours to review these medical conditions individually and give you a better idea of what you should be prepared for and how you should accommodate these medical conditions in your geriatric clients. There are muscular changes that happen as we age. Our bone mass decreases in addition to the body mass of the muscle itself. Fats are deposited in the muscle tissue and our muscle fibers shrink and they're replaced more slowly. We're more prone to falls as we lose strength and bone mass as well. Our nervous system, we lose nerve cells and the general way of our nervous system as we atrophy and age. The nerve cells pass messages more slowly than they have in the past. So even if you can still have sensation or feeling, it might be a little bit slower, which makes them more prone to burns if they lean against a stove or a hot surface somewhere. They just don't feel it as quickly as you normally would when you're younger. As you age, your skin is changing. You're losing elastin and collagen and subcutaneous fat. And again, there's slower wound healing. Our nervous system usually isn't even working that well to understand that you've been injured and need repair. Of course, things like shingles happen at about 50% of cases are in geriatrics 60 years old or older. Now, if you say somebody is a geriatric client at 60 years old, they'd probably say, oh, no, I'm not geriatric yet. But for our 20 and 30-year-old massage therapist, they probably consider 60 geriatrics. It's up to you to determine what that age might be to define a geriatric clientele. With geriatrics, there's all types of bone changes. So our spine changes. A lot of elderly have medical conditions such as spinal stenosis and spondylolisthesis. They might have surgical repairs for this. This is not something that requires just less pressure. You really need to learn about these changes to be able to best serve them. Continued bone mass changes might create a condition like osteoporosis. They might have compression fractures in their spine. They can it's almost like we shrink with age, right? We become shorter. It's not just the loss of tissue in our body, but our arches actually become more flat as well. As we age, we're more subject to joint replacements, hip replacements, knee replacements. There's very specific ways that we need to treat these when working with a geriatric clientele. Geriatrics have all types of foot problems. They become worse with age, not better. So you're working with hammer toes, bunions, there might be toenail fungus or gout. All of these medical conditions, their risk factors increase with age. And some of these, once you have these medical conditions, you're at higher risk for these medical conditions to return. Don't even get me started with arthritis. There's so many different arthritic conditions that happen with age. And these are something that we review in much better detail in our 6-hour training. There's endocrine and hormonal changes that affect the entire body with the aging process, and it's not for the better. We have cardiovascular changes. The entire cardiovascular system degenerates with time. You need to know the problems that occur with congestive heart failure or CHF. And, you know, if this person is even safe for circulatory massage, we'll review all of this in our 6-hour course. Also, you need to learn the signs of angina and when to call, maybe to call 911 for your geriatric client. This might sound all scary and, oh my goodness, I don't want this client on my table because there could be so many problems. These are really rare that they would ever happen in your massage therapy treatment room, but it would be your ethical duty to learn these medical conditions so that you can appropriately respond and help your client receive the best possible care. Our pancreas changes with age. Our fasting glucose levels rise significantly after age 50. The liver changes, our ability to withstand stress, and even for the liver to repair itself. All of this decreases with age. Our kidneys and our ability to filter decreases. The toxins from our body decreases with age. Of course, we have incontinence issues that happen with age. Our vision, our eyes, our hearing, all of this can change with age. Things such as a glaucoma, where there might be pressure in the eyes as we age. Glaucoma usually develops in the later stages of life. You might want to change your face cradle cushion, or that you might not be able to put them in prone position at all with glaucoma. It just might be too much pressure on the eyes. If again, this has nothing to do about doing lighter pressure massage for a geriatric. You need to learn these medical conditions so that you can accommodate them and provide them a really great service that doesn't cause them more pain. There's also mental and psychological issues that might happen with age. We have our geriatrics developing things like Alzheimer's disease, or they might have dementia. In some cases, you might want to keep the client clothed. You don't want them losing track of where they are and all of a sudden coming to and wondering why they're naked and a stranger is touching them. We review all of this in our geriatric bodywork class. So again, my name is Selena Belisle. I'm one of the instructors here at CE Institute, and we do teach a 6-hour geriatric bodywork class. And trust me, it really has very little to do with applying less pressure and more about learning the aging process so that you can accommodate all of these different medical conditions. Keep in mind, all of us are going to be going through this aging process ourselves. So it's kind of nice to learn about it and what we can do to even help ourselves as we age. So you can find this class, our 6-hour geriatric bodywork class, which covers all the material I just shared with you and more in much better detail at ceinstitute.com. And we hope to see you in one of our live trainings. Until then, be safe.